we will now go to our open discussion to get the ball rolling. Maybe we can start with a question of what the goal is of the drug setting framework. Like now that we have dissected these elements, seeing the different realities, the dynamism of the individual, where does that lead us?
Right. Yeah, very, very, very interesting question. Parang bakit ko to ginagawa, no? Number one is what I've mentioned. One of the intention of doing this is to have a big picture of the individual, no? Isolating the individual from the context of drugs, no? Na parang usually kasi whenever we encounter people who are involved in drugs, ang nakikita na natin ay yung droga sa kanilang pagkatao, no? Na hindi na siya nawawala, no? Nakalimutan natin, what we forget is the humanity behind it. That there are factors that they too are considering and that pushed them into doing this and manifesting this behavior. And I think that's one of the intentions of using that tool. Another would be coming from the context of harm reduction, Rod, no? And it's really very important na, okay, nalaman ko, naintindihan kita, and then what now, no? So what's most important is, what you would do after. As a matter of fact, doing the drug setting alone is already your first step towards harm reduction. That's harm reduction na, no? Because unang-una, ibinabawasan mo na ang stigma mo towards the individual. No, you're painting a picture of someone who is human, who has an emotion, who has a backstory, who has decisions and choices na pinili niya, no? At ito ay kanyang karapatan. The mere fact that you are encouraging the upholding of one's right is already one of the first steps of harm reduction. So after that, we'll look into how we could manage each area that we have identified in order to reduce harm. No? So malalaman ko na. So ito yung substance of choice mo. So if this is your substance of choice, ano yung dosage natin? No? How is it administered? Needle ba? Is it injected? If it is injecting, are you ensuring that you're using fresh needles? So you see, verticalized yung approach. Hindi yung buo na itigil mo yan ay masama, yan ay pinagbabawal. You see, making a person aware that you are looking at the behavior and not the individual says so much about the kind of conversation and the quality of your interaction. And by providing appropriate solution as identified by your drug setting will help you be able to manage to help the individual manage with you and at the same time manage yourself when it comes to your recommendations and the solutions that you would offer.
Amazing. Thank you, Orly. Yeah, what I got out of the answer is really how this becomes like a first step, an introduction to the harm reduction response itself. It is the response also because we get to see more of the range of realities that we talked about during your presentation. And something related to that, another question that we have here is maybe more of a concrete way of using the DSS framework about reconciling using the DSS framework as the go-to mindset vis-a-vis having understandable and strong feelings of grief and anger when someone was directly harmed by a situation that involved drugs. So how can we maybe dissect something like that? It's a very complicated situation, but I think with the DSS framework, there's something there that could help us maybe understand the situation some more. Please give us your thoughts on this.
Right. Yeah. Thank you, Mon, for sharing your insights and for posting your question. It's really interesting how you could use the drug setting framework, no, in terms of my understanding of the question is. Right. But my understanding of this is the person himself, no, using DSS for someone, no, where in fact meron na siyang biases. That's my understanding mo, no. Well, at that point, you might want to, and that's the reason why towards the end of of our presentation, I mentioned here that it's very important that we first ask ourselves, no, nasaan ako sa sa usaping ito, no, ng drug setting? Where am I in terms of my biases, my prejudice, no? And how could I manage them before I move forward and continue the conversations? And start and initiate conversations with others. You might want to check on your DSS yourselves, and that's what we did. No, before when we learned about Elgrat's 2002 rethinking of the DSS, we were very excited that looking at everyone, parang may bago akong shades, parang may bago akong perspective. I have a new lens, and I'm also always looking at everything from a DSS perspective. And eventually, we realized that meron din pala akong biases, and I have to manage those biases first before I could extend and be more empathetic in emotional intelligence. Nauuna talaga ang self-awareness, no, as a competency. Before we could effectively identify where others are coming from, it's really it's most important that we be able to identify ourselves, know ourselves first. And at the same time, yung second, self-regulation, manage myself first before I could effectively interact with others. I hope I was able to give clarity on that.
Yes, Mon actually responded on the chat. Well said. Thank you, Orly.
Thank you, Mon.
Awareness and self-regulation, two important things that we can learn from through doing the DSS framework. Let's move
Right.
on to another question here from Jonna. She said, aside from Randy Ribay's excellent book, can you recommend other literary works or films that provides a healthy discussion on drugs? So here we start our deep dive into pop culture, Orly.
Right. Thank you. Oh, nakikita na natin yan, ano. So, ngayon, um, um, ngayon, Jonah, siguro, ngayon na we are aware of the DSS framework, makikita na natin yung value in Disney works like Maleficent. You get what I mean? Like, ano bang bago ngayon? Cruella de Vil, di ba? So it's humanizing these villains, no? And in the same way, it presents a bigger picture of the humanity of the villains in our media. So siguro ngayon, no, makikita natin yung magiging critical na tayo kapag nakakita na tayo ng mga characters in our teleserye na drug addict, tapos siya yung kontrabida, siya yung laging mukhang, ang makeup niya laging walang tulog, you know, things like that. And probably it's something that we could look at and critique moving forward, no? I have actually provided in the abstract a list of other works that you could check. One of which would be the classic Catcher in the Rye, diba? Na parang it was actually very much banned when it was published. It wasn't very much well received during the time of publication. But through the years, we see value in that. We see value in not justifying behavior but saying why behavior came about, no? At nakikita rin natin ito yung parang the last one novel that I came across when I was doing this research and which I reread was the title is The Last Thing I Remember Before I Blacked Out. So it's about alcoholism naman, ano? So as you can see, the drug setting framework may be so dynamic, no? Pwedeng paltan yung drug factor anytime. And it could be alcohol, it could be sex, it could be ugaling hindi mo gusto, no? And as long as you would change it with behavior and then look at the setting and then the set. If you would have time, Jonah, we could have a talk, and I'd be happy to personally share that with you in the SOS booth later. I was given my own table in the booth for us to continue the conversations after this talk. And I'll be very much happy to share with you a few titles, no, that we could read and promote, no, as we look at how we could integrate and find and use the DSS as our lens in criticism and readings. Thank you, Jonna. Thank you, Rod.
Yeah, it's very exciting because now we get to see contemporary literature, also films in a different way if we use the DSS framework. Some suggestions here in the chat include The Queen's
Yeah.
Gambit, for example. And yeah, we can continue the conversation with Orly in their booth at SOS. You can also grab a copy of their abstract. So that'll be a nice, chill conversation, maybe over lunch or after all the sessions today.
Fantastic.
Here we have another question from Melinda. Considering the existing policies penalizing drug users, can you recommend or suggest policy advocacy strategies?
Napaka okay. Well, if I may be honest, no, Melinda, I'm really very transparent when it comes to this. I am coming from the learning and development practice, no. So, in terms of policy advocacy, this is something that I am still to learn, no. Kung paano ako makakatulong sa advokasya ng pagbabago ng ating mga polisiya. This is something that I'm still looking into. But at this point, what we can do, no, in terms of using the drug setting framework is to continue on or probably start and and collecting cases and studying people and putting them in literatures in the things that we do in that we write and publishing them, because eventually when it comes to the time when we advocate policy change, when we promote new reforms and our laws and our policies, meron na tayong data na nakalap mula sa ating mga karanasan and from the conversations and research that we have had. But at this point, no, my experience, no, and my competence in policy change is kind of limited, no. Actually, mas magaling dyan yung mga iba kong kasama sa safe open space. I hope I was able to satisfy that.
Yes, and I think in that, the continuing the conversation thing, maybe Melinda can visit your booth also to talk with other members of SOS to discuss topics like these. Yeah. Well, Noemi was just asking about what time you'll be in the booth so that
Hi,
people will.
Mami.
Yeah.
After this, I'm going to the booth na. I'm going to the SOS booth. I'll have ano ba, may hashtag yung table na ginawa sa akin. Hashtag drugs in pop. Yata. Parang ganun. Hashtag drugs in pop. Parang ganyan.
There. So you can expect Orly after this session to be there. Thank you. Another one here, another question is about how do we approach, or any suggestions on approaching people who have no awareness or maybe little awareness of their own biases, especially when it comes to using drugs or people whose lives include drugs?
Wait lang, let me check. From whom to, no? How do we approach? Is
From
it in the
Freda.
ano?
Yes.
From Freda? Any insight? Hi, Freda. It's nice to see you here. Freda's a friend. Any insight or suggestion on how we deal with people, tama ba? Who claim? Is that what you read, Rod?
Yes, that's right.
Those who have a brutal approach in the drug war. I mean, basically people who have no awareness of their own. Are we talking about people who are involved with drugs here, Freda?
I think I'm assuming from her question, it's more of the people who might have biases against people who use
People who
drugs.
use drugs, yeah.
How do we, using, for example, the DSS framework, how can we approach them? Maybe also introduce the framework to them. Yeah.
Well, Freda, the good thing about the DSS, no, whenever we use it and whenever we interact and have conversations with people who have prejudice, who have biases against people who involved in drugs, is that first we respect their DSS. We respect their setting na muna, no? Their behavior, we respect that as well. Inalayo namin siya from the individual. And we look at the areas na dapat na pwede naming ma-manage, things that we could somehow influence, no? Definitely there will be people who will have biases, and we cannot get away with that, especially in the kind of environment where we are right now, where stigma is very much institutionalized, and we have to take that into consideration. So if you would look closely at these people living in a society where that has institutionalized stigma on people involved with drugs, mas naiintindihan natin sila ngayon at maaaring dun magsimula ang ating mga conversations with them, no? Understanding where they're coming from and probably tapping on how we could promote potential harm reduction na parang what we can what we because what we can share with them too is that drug use is drug addiction is not a disease, no, it is not criminal, it is a mental health issue. At ito yung isa sa mga dapat nating tingnan, no? And just by looking at that from that perspective, nagbabago ang ating pagtingin doon sa behavior. At nagbabago, and we are starting to be able to see potential solutions on how we could help and augment and provide potential services for that, no? So maaaring maintindihan ko ang isang tao kung bakit siya may biases, kung bakit siya ay galit na galit. Maaaring meron siyang nakaraang karanasan at maaari natin itong pag-usapan, no? Nang hindi natin hinuhusgahan muna yung tao, na hindi muna natin siya binabangga. At and that's where you could start, no? Embracing these ranges of realities. Yun nga yung sinasabi natin. Mami Noemi, I'll be in the room. I'll be in the SOS booth later, immediately after this talk.
Thank you, Orly. That was so great. Using the DSS framework also to kind of break down how how people who might have uh, no awareness of their own biases and being able to also look at which entry points we can come into so that we can start the conversation to happen. Maganda,
Right.
maganda. Here, one from Attorney Tetay Mendoza. How do we use DSS when, for example, busting the mainstream myth of the link between drugs and crime? Do you have
Let
any thoughts
me
on this?
let me check. Is it in the question and
Yes.
answer from
Uh,
Attorney Tetay? How do we use the DSS when busting the mainstream myth on the link? When busting the main what do you mean, Attorney Tetay, when you say we're busting the myth, mainstream myth of the link between drugs? Okay. So, yeah, no. Well, it's also something, no. I'm taking it from where I am, no. I'm not sure how you as an individual, no. But if I may just answer this from where I'm coming from, based on my own reality, no. In us in SOS, what we do is that whenever we would have exercises or conversations amongst ourselves. Orly, me, coming as a learning and development practitioner, I use these resources, I use these articles and works, no, and share this with my partners and my learners, and we demystify it accordingly. So kinikritik namin siya together, no, na parang if I am to rewrite this, if I am to do a research on this article, ito sa subject na ito, ano yung prosesong gagawin ko? And if I'll be using the DSS framework, how will I do it? And how will I construct this entire narrative? How will I rewrite this narrative? No, and that for me is my way, no, of demystifying this with my immediate environment and people in SOS. Another thing also would be yung concept of encouraging people to go beyond, to go to click beyond the catchy social media headlines, no, na parang drug addict pinatay, no, na parang pagkatas nun, kasi addict yan, magko-comment na ako, no, so parang one of the things that we recommend is that, you click it and you review the article, you critique the article, you look at how the article or the writer presented the subject in the item, no, and probably something that could also be an opportunity for further conversations as you move forward um with creating, with narrating and presenting individuals in news and in media. I hope I was able to give clarity on that, Attorney Tetay.
Thank you, Orly. I think yeah, it's really like reviewing. And some Joel mentioned also like crime setting, for example, which makes the DSS very versatile in terms of what we're looking at and breaking down. Uh, Yeah, just to remind everyone, there's also a raised hand option. So if you want to join us on stage, you can raise the raise hand button, and then we can invite you to ask Orly a question. Maybe you also have comments or thoughts on the discussion itself. So please feel free. But maybe before somebody raises their hand, we can ask one more question. Um, a question here is would love to know your epiphany shifting from the old framework towards DSS. What did the shift look like for you, Orly?
Okay. Are we talking about, see, this is Mama J, right?
Yeah.
And we're talking about the shift from the original DSS framework to the new framework, right?
She meant like how you used to look at things, you as personally, like in terms of drugs or drug use, towards now seeing it shift into drug setting.
Right. Thank you, Mama Je. It's actually very refreshing to have Mama Je asking this question to me. No, for everyone in the room, Mama Je is one of my early mentors in harm reduction when we were getting our initial training on harm reduction many years back. Uh, when we were still uh, convening SOS. And well, the thing with having this framework and using this no as a lens for newer perspectives is that Mama J, it influences my behavior as well as my outlook when it comes to the kind of quality conversations that I have, especially when we talk about drugs, when we talk about people who are involved in drugs. Another would be yung mga biases ko, no? Uh, it starts to it helps me manage myself and regulate myself in terms of my conscious and unconscious biases towards drug use, towards people who are using drugs, towards addiction, things like that. And finally would be language. And for me, Mama J, this is really very important because in my practice in what I do as a learning and development professional, language is really very important. At the DSS framework um provided me with this awareness of the language, the use of appropriate language, something that is more inclusive, something that doesn't stigmatize, no, and at the same time something that empowers the individual further while upholding the individual's rights and dignity.
Great. That was such a inspiring. Same. I feel the same way when I was introduced to drug setting. You know, it really opens up your mind to more
True.
like how intersecting all these issues are and being aware of how we respond to them also. So thank you so much, Orly. We have time for one or two more questions. Again, raised hands is an option here. You can join us on stage. And again, Orly will be on the SOS booth after this session, so you can join him for lunch. You can talk over the lounge. The name of the table is
Hashtag drugs pop culture, I think. I'm not
hashtag.
sure. If Jake is in the room, probably he could share. Well, makikita naman siya eh. So I'll be there naman. I'll
Yeah.
just be in the room if you're interested. And then all you need to do is just, let's continue the conversations in the SOS booth.
Yes. We have a question here from Professor Grace, Francis Grace Ducapante. The drug issue is a complex one. In our context, we have strong religious and cultural factors that can hinder people into shifting to the harm reduction mindset. Do you have any suggestions now on how to manage these hindering factors?
Let me just read, no, Professor. Tama, Professor Grace?
Yes.
Yeah, complex one. Context. Right. First and foremost, I'd like to go back to the concept of how do we begin. No? Saan tayo nagsisimula? Nagsisimula tayo sa sarili natin. No? Bago natin gamitin ang lensing ito para sa iba. No? It's most important that we use this lens for ourselves first and examine how our own biases and our settings influence our judgments and the way that we communicate and manifest and view the world. Um, Another would be there are definitely no strong religious and cultural factors that are affecting each and every one of us. At ito ay dynamic, no? Maaaring sa akin hindi ganong kalakas ang simbahan, maaaring sa iyo, Professor Grace, malakas ang religious factors. Malakas yung influence niya sa iyo. It could be different, no? But if it's something that you can but if it's something that you can manage on your own, no, first, no, sa sarili mo, probably it's also something that you could use for others, no. But what's most important using the set setting framework is using the set setting framework in this situation is to look at the cultural factors that are affecting, no, and managing access to these factors, no, probably talking about them, managing them through your conversations. At the end of the day, Professor Grace, the goal of the set setting model is not to change the individual, but to make the individual realize what needs to be changed, no. And tayo lamang ay nagbibigay ng potential options para sa kanila, no. And that's where harm reduction and human rights marry together, no, na parang ako ay may intensyon na mabawasan ng harm sa iyo at matulungan ka, pero syempre ikaw pa rin ay may karapatan at ikaw pa rin ang magdidesisyon para sa iyong katawan at para sa iyong buhay. The least that I can do is to provide you with options and something that we could work together on for us to, achieve reducing harm.
That's nice. And I think that's the essence of harm reduction, right? The being able to work together, giving options, being able to walk with the person through their journey. So thank you for that, Orly. We have one from Jessa here who wants to know if we have manuals or books on DSS that we can utilize.
Well, we have prepared an abstract for you, and I think it's an 11-pager abstract on the paper that I presented today, no. So we'll be more than happy to share it with you, Jessa. Just visit us at the SOS booth later.
Yes, thank you. And apart from that, Jessa, actually, we also have books like Over the Influence, whose authors are Dr. Pat Denning, and Jeannie Little, who will be with us tomorrow also for their session on community harm reduction. So if you want to join us for that session and ask your questions there, we'd be glad to entertain. There are no more questions in our Q&A. So I would like to thank Orly today for joining us and for giving us such an inspirational talk and breaking down Randy Ribay's Patron Saints of Nothing today, giving us a taste of the drug setting framework, an empathic framework that lets us see the dynamism of the individual, and we get to dissect the elements and embrace the realities of the person. Thank you, Orly. Do you have any last words before we end?
Well, as what I've mentioned, this is something that is kind of new, no, when it comes to learning and development and in education. But by integrating something like this in the things or in the literatures that we teach, we could provide our learners and our students with a more diverse and inclusive understanding of literature as well as of people in the community. Thank you very much, Ruod. And thank you everyone for joining our talk this afternoon. I'm really very happy to see you.
Thank you. Thank you, Orly, and thank you everyone for joining us today.